Hi everyone, we're back in the operating room with Roseanne. Roseanne, for her clinical ladder activity, is going to demonstrate how to break down a bed for us. Before the patient arrives into the OR, we want to remove the head of the bed and bring it down to the foot of the bed.
Somebody, anybody.
All right, so that's going to lengthen the bed so that when your patient comes into the operating room, their head will be a little bit higher on the bed and their hips will be sitting right in the middle where they need to be, because we're going to further break it down and put the stirrups on. Next, the patient's going to be coming into the operating room, and we'll have the patient move over to the operating room table. We may have to assist her if she has spinal or any anesthesia on board. Okay. And then, of course, at this point, anesthesia will probably have you pause so that he or she can get everything ready for the patient to potentially do general anesthesia or possibly dose the spinal or the epidural catheter. So the next step is to place the candy canes. And when you're placing the candy canes, you have this little apparatus that holds the candy cane, and that's going to slide on. You have to be at those brackets. You've got two brackets. This is going to fit right into that bracket. So once you put that on, you're going to move it down to the patient's hips. You want to be parallel or in line with the patient's hips. And this little piece that has the hole in it, that's where your pole is going to go through. So you want to make sure that that is straight so that your pole can go right into it. Okay, so the bottom of the candy cane fits right into the hole.
Just keep going.
And you're going to tighten it, and just, you're going to be turning it to your right. So whether you're on the other side of the bed, just think righty-tighty, lefty-loosey. So we're going to tighten that bar in place. And again, this is parallel with the patient's hip. And then the next step is to line up your actual candy cane straps that are going to hold the patient's foot and ankle. And you want to make sure that this curved candy cane piece bar is facing the opposite shoulder. So might need to adjust it just a little bit to point towards the patient's opposite shoulder. And that's how you have it. It's going to be to lift the legs up into the stirrups once the patient is asleep. And you want to do this simultaneously with another nurse or your surgical tech so that you can help support both legs and hips at the same time. So the first strap goes on and it's going to sit right behind the patient's ankle. And then the next strap goes on and it's going to sit right in the middle of the foot.
There.
You may have to adjust a little bit based on your patient's size and length. Okay, so now we're going to break down the rest of the bed. So the part of the bed that Roseanne moved earlier is going to come out, and you're going to set that down. And then the next step is going to be taking this piece of the bed off, and it just lifts right off and comes out. And now your anesthesiologist is going to lower this section of the bed. Okay, so the anesthesiologist is going to lower the bottom of the bed. Okay, and then this obviously drops down, and your patient, as you can see, her buttocks is hanging off the bed just perfectly. And then we're ready to do our perineal prep. I'm going to do this in reverse now. The patient has had her D&C, and the bottom of the bed is going to come back up. You want to be careful that your patient's arms are actually out on the arm boards as well, and you want to just make sure that as the bottom piece of the bed comes up, that their hands and fingers, okay, stop. Their hands and fingers are not in the creases. Okay, so we took that piece off, and now that piece fits right back on here. You're going to see these little divots here where your bed, the bottom of the bed will fit right in there. And then the foot of the bed slides right back in. And now we want to take the patient's feet out of the stirrups. And again, you want to do this together with another nurse or surgical tech because you want to support them at the same time. So we're going to just remove the stirrups. We're going to bring her knees together in the middle and then down gently.